As some of you may know, I have recently become a parent. And with that responsibility comes nursing and feeding. And over the past couple days, I have been doing some of the nursing and feeding. And it has led me to get neck, upper back, shoulder, even wrist and forearm pain from holding our little bundle of joy. But with a flexed wrist, a flexed elbow, internally rotated shoulder, and my head is down. So basically everything is a little bit sore. My body's just not used to this. And if you're a new parent or you've been a parent for a couple months, you probably are going through this as well. It's something that I call parent trap. Although being a parent is a wonderful experience, it can lead to a little bit of discomfort with all these feeding. So I'm here to show you 7 things to help. All you're going to need are a foam roller, a door, and maybe even a mobility peanut if you have it, and we'll get to that in a minute here, so follow along. So when we're holding our babies and looking down, making eye contact, we are rotating our head and flexing it towards one side. So we're actually giving ourselves a stretch on one side of our neck. But depending on which arm you primarily hold with, what we're doing is we're shortening one side of our neck. And so what we want to do is we want to do an upper trap stretch, maybe even a levator scapula stretch, to open up the side of our neck. And to do that, all you're going to do is take your hand, you're going to place it over the top of your head. So if I'm stretching out the right side of my neck, I'm using my left arm and I'm pulling directly over to the side. I'm going to hold this 60 seconds, and maybe I feel a big stretch, maybe I don't. But what you can do if you need to find your stretch, meaning that everybody's stretch is different, you might want to turn your nose towards your pulling arm. And then you might feel a little bit more stretch. And so that is going to be either an upper trap stretch or a levator scapular stretch. Either way, we're stretching out the side of our neck to undo all of the turning and looking down that we've been doing. Okay, if you're like me and you're holding your child, you have a slightly bent wrist because I'm trying to support their body and their neck and hold the bottle. But because of that, I'm putting a ton of stress through my wrist flexors, and that's something that we want to stretch out. It can easily be done with a wall, but in this instance, I'm going to use the floor. So all we want to do is we want to turn our fingers down towards the ground. We want to face them towards our knees once they get on the ground. Shoulders are away from our ears, and then you're just going to rock back and gently come forward. And we're just going to do this for a minute. And you might feel a big stretch in your wrist flexors, and that's what we're after. There shouldn't be any numbness or tingling in your hands. If there is, maybe back off the amount that you stretch backwards. And so like I said, we're going for 1 minute, and you can do this throughout your day. By now, most of us have one of these laying around. It's a foam roller. If you don't have a foam roller, sorry, you should probably go out and invest in one. I'll put a link somewhere to get one. I think there's one in my profile, actually, where you can grab a good one that comes with one of these peanuts as well, which we're going to use in a second. But you're going to take the foam roller, and you're going to place it on the ground. It's going to go right between your shoulder blades horizontally. You're then going to give yourself a big hug to get your shoulder blades out of the way. You're going to lift your butt, and you're going to go up and down. You might get some cracks and pops, and those are free of charge. But we're just trying to mobilize the muscles, maybe put a little bit of a mobilization into the thoracic spine, go in a forward direction. We're just going to go up and down, maybe 10 times, and then relax. Maybe rest your neck for a second, and then go up again and do 10 more times. As we're holding our children, we're rounded forward, we're looking down, we're making all that wonderful eye contact, except we're doing this. Now, we do that enough throughout our day, especially with working and TV and driving and all that stuff. So when we add holding however much weight in our arm while we're doing our nursing, we're really rounding forward into flexion. And so you're going to take your foam roller once again. It's going to go right between your shoulder blades onto your thoracic spine. This time you're going to keep your butt down. You're going to put your hands on the back of your neck to support your head. You're going to just arch back. You want to try to maintain your ribs down, okay? So we're trying not to let your ribs flare. If they do, it's okay to start, but we are going to want to gain control and then just get pure thoracic extension or mid-back extension over the foam roller. And so you can do a couple reps in one spot, and then maybe move up on the foam roller a little bit more, keep your ribs down, and arch back. This is probably the strangest one of the lot, but it kind of feeds into that we're always flexed with our head and our neck and our thoracic spine mid-back. So we want to undo it. We want to feed some extension into our spine. To do that, we're going to do chin tucks, which everybody loves doing, and adding some extension to it. And a chin tuck is very simply retraction of my head. Okay, so I'm not extending my head yet, but I'm pulling my chin back, giving myself like a double or triple chin, and then from here, then I go into extension. And I reset, kind of get into that weird slouch posture, pull back, and extend. We're just doing 5 of these. And you'll see that when I pull my head back, I'm actually kind of opening up or creating some space in the back of my neck where I can then extend from comfortably. Because if my head is forward, like it would be when I'm nursing, and then I go to extend, I'm just crunching or crushing everything in the back of my neck. That's not what we want to do. We want to open up those joints and let them naturally extend by doing a chin tuck first. And once again, you can just, sprinkle 5 in throughout your day, maybe right after you nurse. That would be a great time. All right, anterior shoulder stretch. This is definitely one of my favorite stretches. I love doing it with the ground, but you can do it with a desk, a countertop, a table, something else you can hold on to, maybe a doorknob behind you. But the gist of it is that you're gonna have your arms behind you. We're opening up the front of our shoulders because constantly we're internally rotated and our elbows are forward. So we're gonna try to externally rotate and bring our elbows backwards, which is gonna open up the front of our shoulder. So you're gonna sit on your butt. You're gonna have your fingers pointed behind you, away from you. Tall chest, proud chest. And you're gonna scoot your butt forward until you feel a stretch in the front of your arms, right through here. Now once again, I don't wanna be feeling numbness, tingling, burning, any of that stuff in my fingers. If that's the case, just move back just a little bit. Take some of the pressure off your nervous system. You're gonna have that tall chest. We're gonna be hanging out here for 60 seconds. Now, I love doing this one, probably out of the whole lot. This is probably the one that I feel for me right now is providing the most benefit. Everybody's a little bit different. So find the ones that you enjoy. But this one, this anterior shoulder stretch, we're just hanging out 60 seconds. Stretch out the front of the shoulders. So you've been nursing, your shoulders internally rotated, they're forward, you're rounded. We need to open up your chest. We need to get your mid-back, your thoracic spine to move a little bit more because it adds up all the time that we spend flexed. And your spine starts to basically remodel, or the soft tissue begins to remember that flexed position as your baseline. And so we want to feed it some more extension, just like almost everything else that we've been doing. And we want to add a little bit of rotation to get some mobilizations to the thoracic spine. At the same time, we're going to get our arms back here to open up your chest, stretch your pecs a little bit. So you're going to be sitting nice and tall. Actually, grab your foam roller that you had before. You're going to put it between your knees. You're going to be nice and tall, not ribs up, okay? But just tall. And you're rotating. One breath out. Rotate. One breath out. Side to side. You're keeping your elbows wide the entire time. Okay, so we got a little bonus here. We've got our mobility peanut. I do have these for sale on my website. You can find that through my link tree in my profile. But these guys are really good at getting the tissue that is directly on the sides of the spine. That goes from the base of the skull all the way to the low back. It can help mobilize, stretch, bring some blood, all that good stuff. And it has a nice little space for your spine. So all you do, kind of like the foam roller, you get this guy down on the ground. Now it is more aggressive than the foam roller. And say I want to get the back of my neck just right up at the base of my skull. I can hold it here. I can just let my head relax. I can do some flexion and extension. I can move this guy down between my shoulder blades, get my shoulder blades out of the way, maybe get some more mobilization, some cracking, some popping, work on my extension. Just like with the foam roller, a little bit more aggressive. I can even go side to side, to get some of that cross friction massage, that perpendicular input to the muscle that is really, really good at getting them to relax. Oh, maybe you'll find some spots that you just really want to park yourself on and do some deep breathing. So you can throw that in there. Maybe the foam roller is too gentle for you. Maybe you feel like this is just a little bit more precise and gets you the mobilizations that you need. Okay, last little piece of bonus material is prone to supine rolling. That's stomach to back rolling. And what this is great at is opening up your chest, opening up your shoulder, getting rotation in your thoracic spine, and feeding extension into the entire spine. You're basically literally undoing this position where I'm flexed, I'm across my body, I'm internally rotated. We're going to go into external rotation and bring our hand up towards the sky, rotating our shoulders back. Okay, so we're going to be undoing all of that feeding, all of that nursing, all of the holding that we do every day now as parents. So what you're going to do is you're going to start on your stomach. You're going to have your arms extended. You're going to have your head down, but I don't want to crush the microphone here. Let's see. Basically what I'm going to be doing is I'm going to be taking my left arm, just my arm and my head, and I'm reaching up towards the sky. I've got my eyes on my hand. I'm rolling back. I'm leaving my legs behind, and gradually they're going to go, and I'm going to roll onto my back. And now, typically I'll have people roll forward, but because we're trying to undo all of the flexion and internal rotation of our shoulder, I'll just have you get on your belly again, and then you reach up and do it again. And you're going to do this 3 times on each side, twice a day. Now that's after you've done everything, okay? You've warmed your body up, you've gotten some great mobility. This is just that bonus. This is putting it all together to hit save on the document so your nervous system, your musculoskeletal system, all remember, oh yeah, this is what I should do with this extension, with this external rotation. So try it out. It's called prone to supine rolling. Let me know what you think.